Hello guys, welcome back to my YouTube channel, and in today's video we're going to look at this psychiatry Osce exam paper that was written at Levi Manawasa Medical University. My name is Venon Insofa, and if this is your first time visiting my YouTube channel, please make sure that you subscribe and also make sure that you comment as well as share this video. So let us get started. So in today's video we're going to look at this psychiatry paper, exam paper. This is Osce, okay? So let us get started. So what is the first question? So the first question that we have is, what do you see in the image? So when you look at the image, we have got two images here. So you can see that we have got this image as well as that image. So what can we see in the first image? So in the first image, the first thing that is noticeable here is see this upward eye movement. So upward eye deviation. And then you can also see opening of the mouth and also slightly bending of the neck or the head. And then when you look at this, you can see here there's prominent bending of what? Of the head. Okay? So what we can see, these are simply constituting what we call dystonia. So when you look at this upward eye movement, it has got a special name. So this one, we call it oculogenic crisis. And then when you look at this bending of the neck, it has got also a special name. We call it reticulocholis. And these, they're found in dystonia, acute dystonia. So this is acute dystonia. So let us proceed. 2. It is a side effect of which group of drugs? 2 marks. So where are you going to find acute dystonia? So acute dystonia, it is one of the extrapyramidal side effects. And this comes as a result of using antipsychotic drugs. Okay, that's what you have to know. So it's a side effect of using antipsychotic drugs. Then when we go to question 3, these drugs are used to treat which conditions mostly? So antipsychotic drugs, you need to know that these drugs are used mainly to treat schizophrenia as well as the mood disorders, okay? Mainly the bipolar mood disorders. So you need to remember schizophrenia as well as bipolar mood disorders. Then we go to question 4. Question 4, what would be your next step when a patient presents to you as image above? So what are you going to do when you say patient like that? So the first thing that you have to do is to assess the severity of the symptoms. So you need to look at the symptoms, how severe it is, because it's going to guide you what you're supposed to do next. Then after assessing the severity of the symptoms, you can administer anticholinergic drugs such as benztropine and piperidine. These drugs are effective in terms of treating extrapyramidal side effects. You can also use another drug, which is an antihistamine drug that we call diphenhydramine. So these drugs, they are going to simply reduce the amount of acetylcholine in the central nervous system, and this helps in what? In treating these extrapyramidal side effects. So remember, benztropine, we have got piperidine as well as the diphenhydramine. Okay, those are those that we are going to use. So remember, the first thing is to assess the severity. Second, administer anticholinergic as well as antihistamine drugs. So you can administer any of those. And then the third thing that you can do, okay, if you find that this problem is still there, you can also try to switch to other drugs, okay, other antipsychotic drugs, because we have got drugs such as clozapine and also drugs like quetiapine. These drugs, they don't usually produce these extrapyramidal side effects. So quetiapine and clozapine, these, they don't produce these side effects. So you can try to switch to those drugs as well, okay? And also, what you can do also, depending on the severity, maybe a patient comes and you find that maybe the symptoms are very severe. What are you going to do? You can also maybe try to reduce the dosage. So you can try to reduce the dose of the antipsychotic drugs they're giving the patient, okay? So we can do 4 things. Remember, assess the severity of the symptoms. After that, you're going to administer anticholinergic and antihistamine drugs. And then after that, if you find that the problem is still there, you can switch to other antipsychotic drugs, such as the clozapine as well as the quetiapine. And then if the problem maybe is still there, you can try to reduce the dose, antipsychotic dose, okay? That's what we can do. Then we proceed. We come to question 5. Which drug is usually wrongly prescribed concurrently with this group of drug in question and is abused for its euphoric effects? So the drug that we use together with antipsychotic drugs is a drug that we call trihexyphenidyl. Trihexyphenidyl, it is used as a prophylactic drug. So it's used together with antipsychotics for us to prevent these extrapyramidal side effects. So we use antipsychotic drugs. We give them together with the triacylphenidil. It's an anticholinergic drug as well. So it's a prophylactic drug. But what happens that this drug, it causes dependence. Sometimes you're going to find that patients, they are going to start abusing this drug because it produces euphoria. So this drug, it is abused by patients because it produces euphoria. And what you have to know that this drug, prolonged use of this drug, also causes tardive dyskinesia. Okay? So currently, the World Health Organization has actually even recommended not to use this drug. So we come to question 2. So the second question, we can see this package here, and we'll be given a question. The question is, what class of drugs does this medicine belong to? What we can see, the name here, it's divalproex prolonged release tablets, IP. So Divalrex, 500 tablets. So this Divalrex, what is this? So this is simply valproate. So this is the brand name, Divalrex. It is simply valproate. What class of drug does this medicine belong to? So it belongs to anti-epileptic drugs. Valproate, it's an anti-epileptic drug. Then 2, list 2 other examples of drugs in this class. So 2 other examples of anti-epileptic drugs that we have. We have got drugs like carbamazepine, lamotrigine. Okay, those are also anti-epileptic drugs. In question 3, which conditions do we use this drug for? So this drug, which is valproate, it is used for what? It's used for epilepsy. Let us go to the next question. So the next question that we have is, if a patient presented to you with this drug, what differentials would you have in mind that are treated with this group of drugs? So this is fluoxetine. So look at fluoxetine. What group does it fall in? So fluoxetine, we need to know that this drug, it is simply an SSRI antidepressant. Okay? So it is an SSRI antidepressant, selective serotonin reuptake inhibitor. So this drug, it helps in treating depression, obsessive compulsive disorder or OCD, bulimia nervosa, panic disorder, generalized anxiety disorder. So when you see a patient using this drug or presented with this drug, of course, just going to give you that probably this patient is having depression or maybe OCD, bulimia nervosa, panic disorder, or generalized anxiety disorder. So the main use of this drug or the antidepressants is for depression. Okay, but others, OCD, as well as other that I have mentioned. Then we go to question 2. Question 2, mention 2 other many groups of this type of drug and give one example under each group. So which means that mention 2 other classes of antidepressants. So other classes, we've got what we call the SNRI, which simply means serotonin, norepinephrine reuptake inhibitors. So these drugs, they simply inhibit the reuptake of norepinephrine as well as serotonin into the presynaptic neurons. And we've got drugs like venlafaxine and also desvenlafaxine, duloxetine. So those are SNRI, venlafaxine, desvenlafaxine, and also duloxetine. Then under the same antidepressants, the other class that we have are what we call the monoamine oxidase inhibitors. So these drugs, they inhibit an enzyme called the monoamine oxidase enzyme, which breaks down norepinephrine. So when you inhibit this enzyme, we're trying to increase the concentration of norepinephrine. So these drugs, we have got drugs like phenelzine, trinicyclomine, as well as the selegiline. So these drugs, they inhibit the monoamine oxidase enzyme. So remember, phenelzine, trinicyclomine, selegiline. So these drugs, they are going to be used also as the antidepressants. Okay, so remember, antidepressants, we have got what we call the tricyclic antidepressants. Those are simply classes. We also have what we call the selective serotonin reuptake inhibitors and also serotonin norepinephrine reuptake inhibitors, as well as monoamine oxidase inhibitors. Okay, I also want you to know that selegiline, it's the only antidepressant that is available in a transdermal delivery system. Okay, that we deliver through transdermally. Okay, so you need to know it's only selegiline. Yeah, so that is the last question that we have. So these are the questions that I have And I'm going to end here. I'm going to make another video on another paper. Thank you so much. Make sure that you subscribe. God bless.